Irritable bowel syndrome, or IBS, is a chronic and can be a debilitating functional gastrointestinal disorder. This disease can be difficult to live with, and most of these patients tend to utilize the healthcare system more than those without this diagnosis, and even exhibit a poor quality of life. This disease affects the large intestines and must be managed long term. IBS has been known to have no real source of how it onsets. Typically, this disease is known to be a condition with visceral hypersensitivity and gastrointestinal motor issues. There is an increase of evidence as to why visceral hypersensitivity and GI motor issues occur, in addition to the increase of evidence that organic disease of the GI tract can be identified in subsets of patients that fulfill in the Rome criteria that is used for IBS. There are several different intestinal disorders that have similar symptoms to irritable bowel syndrome. Examples include malabsorption, inflammatory bowel disease, similar to ulcerative colitis and Crohn's disease, celiac disease, and microscopic colitis. Some of the causes that can be known to lead to this disease are either a weakened immune system or an overly sensitive colon. When this disease is being treated, not only is there a primary care physician on board and a part of their care, they will usually consult an internist and definitely a GI doctor. The primary care physician and the GI physician will work together to help treat and manage this patient's illness. Due to the nature of the unknown causes of this disease, doctors review the patient's symptoms, their medical history, their family medical history, and they also perform a full physical exam. During the exam, the doctor will assess the patient's pain related to bowel movements, if the pain improves or worsens after a bowel movement occurs, or if there is a noticeable change in the frequency of bowel movements and a difference in their stool appearance. Some of the specific red flags that are noticed include blood in the stool and if the patient is febrile. Most physicians will also run a blood test to rule out any other disorder or order a sigmoidoscopy or colonoscopy, allowing them to get a better view of the inside and any possible defects that are there. Clinical manifestations of IBS can include iron deficiency anemia, bleeding from the rectum or blood in the stools, and unexpected or unintentional weight loss, diarrhea, usually at nighttime, difficulty swallowing, unexplained vomiting, and persistent pain that is not relieved when the bowel is passed or gas is passed. The treatment for IBS is usually managed by diet, eating more fiber, avoiding gluten, and following a strict plan known as the FODMAP diet. Eating more fiber helps improve the constipation with those that are diagnosed with IBS. Avoiding gluten and utilizing the FODMAP diet will help reduce certain symptoms and avoiding certain foods that are difficult to digest. The biggest part of this disease and its treatment and management is dieting and monitoring the symptoms to acknowledge and prevent further complications from this disease, depending on managing what foods you are eating and keeping a diet journal so you know what causes the worst of the symptoms and what can help not cause symptoms. Medications that are used for this disorder are only to treat the symptoms. They do not help cure or fix this disease. Anticholinergic medications are used to block the nervous system stimulation of the GI tract, aiding in the reduction of cramping or irregular contractions of the colon. Other medications that can be prescribed for this disease include antidiarrheal or antidepressants. In using the nursing process for this disease, the first step would be the assessment and what the patient is presenting with, subjectively and objectively. Once the nurse can decide the specific treatment after consulting with the doctor and getting a diagnosis that would be individualized for the specific patient, certain medications can be prescribed to help certain symptoms that they are expressing, and also non-pharmacological treatments to assist in managing the symptoms. A dietitian should be consulted to assist the patient in how to manage their disease properly with food and nutrients that is available. Before the patient is discharged or leaving the office, they should review and prove that they understand and acknowledge what will need to be done. And the nurse will have to evaluate to see if any further education is needed and extra resources provided. Lastly, any level of pain or discomfort should be assessed and managed before the patient leaves, as well as what they will do to further help their management at home, whether it's medications or non-pharmacological ways.